Drooling is one of the most embarrassing symptoms of Parkinson's disease. I remember my mom telling me she'd wake up in the morning and her pillow was completely soaked. She would be mortified. She hated it. And here's the thing. Most people think it's because Parkinson's patients produce too much saliva. But that's not true at all. The real reason is much more interesting. And once you understand why it happens, you can actually do something about it. Today I'm going to break down everything you need to know about drooling and Parkinson's disease. Why it happens, how common it is, most importantly, what actually works to manage it. So, first, I'm going to talk about how common this problem actually is. Because if you're dealing with drooling, you are definitely not alone. Studies show that anywhere from 50 to 80% of people with Parkinson's disease experience drooling at some point. That's more than half of all Parkinson's patients. Some studies put the number even higher, up to 84%, especially in more advanced stages of the disease. But here's what's really interesting. Even though drooling is so common, most patients don't bring it up with their doctors. In fact, one study found that only 16% of Parkinson's patients voluntarily complained about drooling. The other 84% didn't mention it at all, unless their doctor specifically asked. Why? Well, when researchers asked patients why they don't bring it up, here's what they said. 45% thought their motor symptoms were just more important. 32% didn't realize drooling was even related to the Parkinson's disease. 15% didn't think they should mention it to a neurologist because they didn't think they could help them. And 7.5% didn't even think it could be treated. And that's exactly why I'm making this video, because drooling can be treated, and it should be discussed with your doctor, and it's an absolutely legitimate symptom of Parkinson's disease. Before we move on, I want to ask you to please subscribe to my channel so you won't miss any of my future videos, and give it a thumbs up if you enjoy this kind of content or learn something new. Okay, so here's the part that surprises most people. Drooling in Parkinson's disease is not caused by producing too much saliva. In fact, studies show that people with Parkinson's actually produce a normal amount of saliva, or sometimes even less than people without Parkinson's disease. So if it's not excess saliva, then what's causing the drooling? Well, it's a swallowing problem. Let me explain. In a healthy person, you automatically swallow about 2 to 3 times per minute without even thinking about it. It's an unconscious automatic reflex. Your brain just takes care of it in the background while you're going about your day. But in Parkinson's disease, the automatic swallowing reflex slows down or sometimes doesn't happen as frequently or at all. So saliva starts to pool in your mouth. And if you're not swallowing it regularly, it has to go somewhere. And that somewhere is often out the front of your mouth. My mom experienced this, especially at night. She would wake up with saliva all over her pillow. During the day, she could usually remember to swallow more often. But at night, when she was sleeping, that automatic reflex just wasn't working the way it used to. It's not about hypersalivation, it's about hyposalivation clearance. Basically, your body isn't clearing the normal amount of saliva fast enough. Why does Parkinson's affect swallowing? Well, it comes down to a few different factors. Number 1 is muscle rigidity. Parkinson's causes rigidity in muscles all over the body, including the muscles in your face, mouth, and throat. When those muscles are stiff and don't move as smoothly, swallowing becomes harder. Your lips don't close as tightly. Your tongue doesn't move saliva around your mouth as effectively. The whole system just slows down. Number 2 is bradykinesia, which is slowness of movement. This is one of the hallmark symptoms of Parkinson's disease. Everything just moves slower. That includes the muscles involved in swallowing. So even when your brain sends the signal to swallow, the movement happens more slowly and less effectively than before. Number 3, reduced automatic swallowing. In Parkinson's disease, many automatic movements like blinking, swinging your arms when you walk, and yes, swallowing, become less automatic. You have to think about them more consciously. And obviously, you can't consciously remind yourself to swallow every 20 seconds all day long. Number 4 is posture problems. Many people with Parkinson's develop forward head posture. Their head tilts forward and down. When your head is in that position, gravity actually works against you. Saliva pools at the front of your mouth, and instead of naturally flowing towards the back where you'd swallow it. And number 5 is dopamine's role. Dopamine is responsible for sending messages from the brain to the rest of the body. Dopamine controls movement. But it isn't just about movement. It's also involved in triggering swallowing reflexes, as well as many other automatic reflexes. When dopamine levels are low, that automatic time to swallow signal just gets weaker. All of these factors combine to create the perfect storm for drooling. So, when does drooling happen? It doesn't affect everyone in the same way. For some people, it's mostly a nighttime problem. For others, it happens throughout the day, especially when they're concentrating on something and not thinking about swallowing, or when they're tired and their posture slumps forward. Drooling also tends to get worse as Parkinson's disease progresses. It's more common in later stages when motor symptoms are more severe. But that doesn't mean it can't happen in early stage Parkinson's too. Men seem to be more affected than women. Studies show that men are about twice as likely to experience drooling as women with Parkinson's disease. And here's something important. Drooling isn't just annoying, it can actually lead to other problems. Social embarrassment and isolation, depression and anxiety, skin infections around the mouth, bad breath, choking or aspiration, which is saliva going down the wrong pipe into the lungs, and aspiration pneumonia, which is very dangerous. So this is absolutely something worth addressing with your medical team. So what can you do about it? Let's talk about what actually works to manage drooling. But you know what? Before we do that, I really want to give a little disclaimer. I'm not a doctor. I'm just a regular person. I lost my mom to Parkinson's disease after a very long battle. I make these videos to help translate complex medical research into language we can all understand. Nothing I say in this video is medical advice. If you're experiencing drooling or thinking about trying any of these treatments or any others, you absolutely need to talk to your doctor or your movement disorder specialist first. They know your specific situation and what's safe for you. Okay? Okay. Let's get back to what you can do, because there are several different treatments. And what works best really depends on your individual situation. So option number 1 is swallowing exercises and speech therapy. A speech-language pathologist who specializes in Parkinson's can teach you exercises to strengthen your swallowing muscle and improve your swallow reflex. These exercises might include practicing deliberate, forceful swallowing, exercises to strengthen your lips and tongue, techniques to improve saliva clearance, and practicing gathering saliva in your mouth, closing your lips tightly, and swallowing completely. My mom's physical therapist gave her some swallowing exercises to do, and I'm going to be honest, they did help a little when she remembered to do them. The problem was consistency. She would forget to do them, and I would forget to remind her. I think if we had been more consistent with these exercises, they would have helped her more. The research on swallowing exercises is mixed. Most studies show that they help in the short term, but the benefits don't always last long term unless you keep doing them consistently, which makes sense. It's like physical therapy. You have to keep it up. There's a newer approach that's showing promise, and it's called expiratory muscle strength training, or EMST. It's a little device that you breathe out into that creates resistance, and it strengthens both your lip muscles and your swallowing muscles at the same time. Studies show it can reduce drooling and improve quality of life, and people seem to tolerate it well. It's something worth asking your speech therapist about if you're interested. Okay, option number 2, posture and positioning. Working with a physical therapist or occupational therapist on your posture can actually make a real difference. If you can keep your head in a more upright position instead of tilted forward, gravity helps saliva from pooling in the front of your mouth. Just remind yourself to sit up straight and keep your chin level. That can help. Number 3, option 3, oral medications. There are some medications that can reduce the saliva production, but they come with some trade-offs. And since the drooling problem is not really driven by excess saliva, I don't know that these are a good idea, but talk to your doctor about it. So there's anticholinergic medications that can help dry up saliva. The problem is they can cause some side effects. Dry mouth, yes, ironically, blurry vision, constipation, urinary retention, and confusion, especially in older adults. Because of these side effects, doctors are usually pretty cautious about prescribing them, especially for older Parkinson's patients who might already be dealing with cognitive issues or constipation. My mom never tried any medication. Her doctor was more focused on Botox injections instead. Speaking of Botox, that's number 4, option 4. This is probably the most effective treatment option right now, and it was what my mom used. Botox. Yes, the same stuff people use for wrinkles can be injected directly into your salivary glands. There are 3 sets of salivary glands. The parotid glands in your cheeks, the sublingual glands under your tongue, and the submandibular. When you inject Botox into these glands, it temporarily blocks the nerve signals that tell them to produce saliva. So you actually make less saliva for a few months. The research on this is really solid. Multiple large clinical trials have shown that Botox injections significantly reduce drooling in Parkinson's patients, with its effects lasting anywhere from 12 to 20 weeks. They are painful for some people. My mom got the Botox injections, as I said, and they did work for her. They did reduce the drooling, especially during the day. But I'm not going to sugarcoat it. She hated getting those injections. They were painful for her. She would dread the appointment every time, but she kept going back because they did help her. She went every 3 to 4 months. Even with the Botox, she still had some nighttime drooling. She'd still wake up occasionally with a wet pillow, but it was way better than it had been before. One thing to know about Botox, it can sometimes cause swallowing difficulties as a side effect, especially if it's injected into the glands under your jaw. That's why doctors usually start with just the parotid glands in the cheeks. They're far enough away from your swallowing muscles that it's less likely to cause problems. My mom never had any swallowing issues from the Botox, thankfully, but it's something to be aware of and watch for. Option 5 is other options. There are a few other things you can try that may help. Chewing gum or sucking on hard candy. This will stimulate automatic swallowing. Put a sweatband on your wrist. Some people suggest putting a small cloth on their wrist to discreetly wipe away the saliva. You can optimize your Parkinson's medications. Sometimes just adjusting your dopamine can help. And stay hydrated. It makes the saliva less thick and easier to swallow. There are also some invasive surgical options, like redirecting salivary ducts or removing salivary glands, but these are usually only considered for very severe cases that don't respond to anything else. Now, the bottom line. Here's what I want you to take away from this video. Drooling is incredibly common in Parkinson's disease. More than half of all patients experience it, so you're not alone. It is not caused by producing too much saliva. It's caused by swallowing less frequently due to muscle rigidity, slowness, and decreased automatic reflexes. It's treatable. There are multiple options, from swallowing exercises to posture work to medications to Botox injections and even surgery. You don't have to live with it. Talk to your doctor. Don't suffer in silence because you're embarrassed or because you think there's nothing that can be done. There are treatments that do work. And start early. If you're noticing drooling, even if it's mild, address it now. Work with a speech therapist. Practice swallowing exercises. Work on your posture. The earlier you start, the better. For my mom, the Botox injections made a real difference. They didn't eliminate the problem entirely, especially at night, but they improved her quality of life during the day. She was less self-conscious, and she didn't have to constantly wipe her mouth. It definitely helped her. And that's the goal, right? Not perfection, just improvement. Not a cure, better quality of life. So drooling is one of those Parkinson's symptoms that doesn't get talked about enough, even though it affects so many people. It's embarrassing, it's distressing, it can have a real effect on your quality of life and your health. But it doesn't have to be something you just accept. There are treatments, there are strategies, there are specialists who can help. If you're dealing with drooling, please talk to your doctor. Ask for a referral to a speech-language pathologist or to a physical therapist who specializes in Parkinson's disease. Ask about Botox if other options aren't working. Don't wait, do it now. And if you're a caregiver watching this, encourage your loved one to bring it up with their medical team. Sometimes people are too embarrassed to mention it themselves, and they really need someone to advocate for them. If you found this video helpful, please hit that like button and subscribe. The more people that like and subscribe, tell me that people want to know more about Parkinson's research and symptoms. It would also be great if you share the video with others who have Parkinson's disease or care for someone who does. Drop a comment below. Let me know if you or someone you love has experienced drooling and what you've done about it. Has anything worked for you? I'd love to hear your experiences. Thank you so much for watching. Take care of yourself and each other, and I'll see you in the next video.